Medical workers are under the obligation to enforce patients' rights. Dr. Anthony Mugasa, the reproductive rights advisor in the Ministry of Health, says doctors have always enforced these rights under the Hippocratic Oath.
We have an ethical committee which protects the patient's rights. Right to treatment, right to confidentiality, right to privacy, and right to receive quality health care.
Robin Kaiteri Timba, the Executive Director, Uganda National Health Consumers Organization, UNHCO, says the most basic of rights are however violated.
The government needs to work consistently and progressively towards achieving the right to health.
UNHCO is now at the forefront of the 2015 Patients' Rights and Responsibilities Bill, which seeks to radically overhaul standards to ensure that medical practitioners treat patients with dignity.
The Constitution mentions the right to health, but this is not enforceable, it is also not specific.
If there's anything which does not go right, the patients have no remedy.
Namabide Senaburia, the woman MP for Michiana, alongside Milton Muuma Kalulu, the Chigulu South MP, are the lawmakers who are seeking to table the private members' bill.
About 5 years ago, the Minister of Health embraced the Patients' Charter that we had drafted, and it is now a policy document. So the bill is not coming from nowhere.
Health workers are looked at in the economic rights in Article 40, but this particular bill is interested in the patient.
The Minister of Health supports this piece of legislation. However, Dr. Anthony says government for the moment is not under an obligation to ensure that all citizens receive treatment for all ailments. Most stop at essential medicines.
It is cardiac surgery, if it is hip replacement, eye surgery, you name it. The state should be able to provide for its people. As much as the health service providers, the doctors, for example, are obliged to offer the best.
The bill proposes that every citizen is entitled to receive health care unconditionally at private and public health facilities.
Yeah, that should be responsible of the government. When there is an emergency, you must treat the patient and then talk about money afterwards.
To have an ambulance, health workers should have gloves, the theatre should be operational.
A patient will also be entitled to know the health professional who is treating him or her.
Every health worker working on me must have a name tag. Of course, we know there are very many quack doctors who are also working. Now, if they don't have a name tag, then I can sue the health facility for actually not trying to prevail over.
With a raft of other proposals, a patient shall have a right to seek a second opinion and will have the right to seek treatment elsewhere. The patient can also have medical reports transferred to the new health center where he or she is receiving treatment. Another proposal of the bill is the patient is entitled to visitation, though according to pinned guidance of the unit. Others include dignity and privacy, informed consent with a few exceptions, storage and provision of health records.
And you may know also that government is working on a national health insurance. Unless we have the patient's rights clearly spelled out, we will lose. We will pay money to health insurance and we will not be able to get quality.
Moses Talibita, UNHCO's legal officer, says health facilities, especially the commercialized healthcare centers, do not conform to the standards of patients' rights.
There is a lot of mistreatment that the patients are going through because there is no law.
But health practitioners fear that the bill is a smokescreen meant to treat the symptoms of an ailing health system.
Everything goes on going wrong, they say the doctors. Everything going wrong, they say the doctors. Whereas the medical service provision is a system problem.
Now it is the citizens who will hold government accountable to provide what the service providers need.
Many hospitals and health centers are in a derelict state. They also lack enough medical personnel and medicine. In the countryside, pregnant women also endure challenges to access health centers as a result of poor road network.
But even at community level, there should be bylaws that enforce basic things in public health.
The Minister of Health emphasizes the need for you, the patient, to know that you have a responsibility to take charge of your own life.
We can only react or give treatment as long as the client gives us the right information, like giving me the right age, because certain diseases are associated with certain ages.
If a patient is prescribed for treatment and doesn't take it as prescribed, He will be sued in the event any problem happens. If a would have been patient is found using a mosquito net, for instance, for a greenhouse, they will be sued.
Health is made in the homes, repaired in the hospital.
The UNHCR's legal office, however, says the law does not seek to punish health workers, and in case there is a flaw, court will absolve them of any responsibility.
We don't want to have an adversarial system where you sue me, I sue you, I win this. No way. We just want to create an environment because we know health is a collective responsibility.
There is barely any jurisprudence on medical law and practice in Uganda. If the bill becomes law, anyone who renegates on their obligations will be imprisoned for about 2 years or will pay a fine not exceeding 4 million shillings, about $1,400, or both.
And even actually the traditional healers should be included because they're also offering some medicine.
The Minister of Health is advocating for the adoption of a human rights-based approach in providing health care. Florence Nalimba, NTV.